A small primary school in Brisbane's west has done what many others couldn't during Queensland's Omicron wave: remain outbreak free.
We're the only school I know of that's had zero in-school transmission events.
Using a smoke machine, a group of dads at the Brisbane Independent School, including an engineer and medical specialist, studied airflow patterns in classrooms. They identified low ventilation areas using carbon dioxide meters and then used air purifiers in those zones.
I don't have anything else to attribute it to right now except what we've done.
So it's certainly something that can be rolled out across Australia, and the parents that are involved are really keen for people to understand what we're doing.
Other classrooms across Queensland weren't so lucky.
There are some schools where a third of the staff have had to be away, as have been a third of the students.
And it does seem to be particularly affecting children. That's probably because of the low vaccination rates in children.
Just over 22% of 5 to 11-year-olds are fully vaccinated. Nearly 22,000 school-aged children have tested positive in the past week. The Education Department recommends schools open windows, have fans on and hold some lessons outdoors to improve natural airflow in classrooms. But experts say a ventilation audit at all Queensland schools is needed to reduce further virus transmission at schools.
Each classroom, classrooms which do not have enough ventilation should be identified and measures taken.
Only 5 Queensland schools have been audited so far this year. More than 10,000 new infections were recorded in the past 24 hours, almost a quarter of them in children. But authorities say the state is close to the peak of the latest wave. About 3,300 health workers are isolating, putting pressure on the public system.
Each hospital and health service, based on their demands, will be looking at whether they need to suspend planned care. That means elective surgery.
But it won't be suspended statewide at this stage. More than 50 pop-up clinics will be open over the school holidays in a bid to boost child immunisation rates, as students and staff enjoy a much-needed Easter break after a highly disrupted term.
Happy Easter!
Kira Jones, ABC News, Brisbane.